everyone. I'm Gabriel Garcia Lopez, board member of OutCare Health. My pronouns are he, him. Thank you for joining us for OutCare's Out Talk series, a webinar series devoted to discussing diversity and intersectionality within the LGBTQ plus communities. We have many people across the world tuning in today, and we want this to be a safe, welcoming space for everyone. So please feel comfortable asking any questions today. All Out Talks are recorded and can be watched on our website. I am very excited for today's Out Talk, Access to Care, Native, Indigenous, and Two-Spirit communities. Today, we will hear from inspiring people doing amazing work across the country. I am very thankful for our moderator today, John. John, take it away.
Well, thank you. It's so lovely to be here with all of you today, and thank you. I'm very excited about this conversation. One of the things that I think is really important to put very at the beginning of all of our access to care conversations is that I, as the moderator, am not a person of lived experience in this community. So I do want to make sure to center the voices of our panelists as the people with lived experience and expertise that can help all of us in creating a more productive access to care for all communities. With that said, once again, my name is John Sovak. I'm located in Pasadena, California. I'm a therapist and I specialize in working with LGBTQ kids and their families during the coming out process. My pronouns are he, him. And I like to make this a space where our panelists can share a little bit about who they are and what they're doing. So I'm going to have them introduce themselves very quickly, and they get a surprise bonus question that they are not hearing. This is the first time they're hearing it right now. It's very simple. What is your favorite topping to put on ice cream? So with that said, Hannah, I'm going to maybe have you start our introductions today. Just share a little bit about who you are and the work that you do.
Sure thing. Thanks, John. So my name is Hannah. I use she pronouns. I am a physician and a settler. I've worked for the last 5+ years doing 2S LGBT focused work based in Indian country in the United States. And I also work in academia doing direct medical care for both Indigenous and non-Indigenous folks in the Pennsylvania area. And my topping would be on ice cream would be rainbow sprinkles.
Mm.
Not like the dots, but like the long ones.
The real sprinkles. Okay, I'm there with you. Christina?
All right. Hi, everybody. My name is Christina Padilla. My Indian name is the spirit who walks with two feathers. As you can see, my two feathers right there. And I'm also Western Apache. I was born in Tucson, Arizona. And I'm also a Cherokee Nation. And my little girl is Blackfoot. So it's a mix. My daughter's mixed. My pronouns are they, them. And I am a proud two-spirit Indigenous person. And let's see. All I can think about is fudge right now. Okay. All right. That's the first thing that comes to my head is like fudge. I'm the vice president of education and strategic development for an organization called the California Consortium of Addiction Programs and Professional. I'm also, and we certify counselors throughout the state of California. I'm also an author, and I'm also travel around the globe, all over the world, speaking. I'm an advocate, activist for LGBT specific two-spirit Indigenous rights, human rights. I go to DC, I go down to anywhere that will hear us, right? Or even if they don't hear us, we still knock on those doors, right? Also do trainings and all kind of different in Indian country, and also educating different tribes and working with tribes on the reservations and non-reservations, what two-spirit folks are, and encompasses indigenous queer folks as well too, and the LGBT community. And I just love what I do, you know what I mean? And I just want to put more awareness out there for our two-spirit relatives and our indigenous queer relatives as well too. Thank you.
Okay. Harlan.
Thank you so much. And wow, what introductions. Tanze, nitajinik Harlan Pruden, Egwa, Wakano Mani, Niha, Nihia, Niha, Hayakwe. Kinmas Comptonina, Wawa, Squamish Muscom, Scribbish Truth, Nihiao. Greetings, my relatives. My government name is Harlan Pruden, and my niche name, my traditional name, my given name, I was doing some work, some two-spirit work on the Rosebud Reservation, and Marcita Eaglebear held ceremony for me, or organized ceremony for me. And they honored me with the name Waka no Mani. Waka being spirit, like good spirit, bad spirit, neutral spirit. You know, I can do good just as well as I can do bad. Or the worst is suck up a lot of space and do nothing. So that part of my name is, how do I want to show up? You know, I can do good just as well as I can do bad, or I can like suck up a lot of space and do nothing, which I hope I don't do. So I try to show up with good thoughts, good actions, good mind, good, you know. And when I fall short of that intention, you know, a mistake is only a mistake if we don't learn from it. So that's the first part of my name. Nome is two, and Mani is a sacred journey. And so I try to carry that name and to bring honor to the Sioux people that honored me with that name. And I try to live up to that name, just to bring honor to them. I am First Nations Cree. My mother was a member of the Beaver Lake Indian Reserve, and when she married my father, her band registry went to Saddle Lake. And so I'm a registered member of the Saddle Lake Indian Reserve and Treaty 6 territory, and I currently am joining you all from Coast Salish territory. That would be the Squamish, Musqueam, and Tsleil-Waututh First Nations people, or Vancouver. Now, what do? I just work for better tomorrows for Two-Spirit people. And very, very, like, you name it, that is what I've been doing for the past 30 years. It has taken me all the way to the White House, being an Obama appointee to the Presidential Advisory Council, the founding of the twospiritjournal.com, the multi-platform interactive news site. And the latest is trying to, like, through Western research practices, to get in better relations, or decolonizing the research ecosystem through the Two-Spirit Dry Lab is my current work. For the toppings, I'm an ice cream purist. Like, I want ice cream, right? But if I had to like pick something, I would want to just go for like that gooey walnut syrup or whatever. I don't. I just
Oh.
just pour it on top of vanilla ice cream until it like hardens and you can crack it.
I love it. Well, my topping is salted caramel. It's my sweet spot. It makes me happy, and I make a really good one. So if you've never made caramel at home, it's so gosh darn easy. Just do it for yourself. It's so much better than the stuff you buy in the stores. And as you're all introducing yourselves, my first question is, when do any of you sleep? I'm just putting that out there first. But I think as we're starting this conversation, one thing that's really important when we're opening these doors is to really look at some of the language that we're using. And even in the title of this, we're using two specific things. We're using Indigenous peoples, and we're using Two-Spirit. And I think it would be really powerful for us to maybe help our audience understand what that nomenclature means and how it presents out in the community. So I want to maybe we'll start with Indigenous peoples, and then we'll let that flow into Two-Spirit. Anybody want to start us off with that conversation?
Yeah, I'll go ahead. So one of the things is when we're looking at Indigenous means a whole bunch of different things. Specifically, this is when we're talking about Native American. Some people say American Indian, Native American, but since you put first Indigenous, it also could even speak to in Mexico, like for the Aztec, because we have Aztec relatives as well too. But I know today it's specifically like we're looking at, sovereign or non-sovereign, or specifically to Native folks from different reservations specifically. But I do want to let the population know that's on here, participants, that they might be Indigenous as well too. And I don't want to push them out, but I do want to let them know that because of what we're saying, we're specifically talking, in my understandings, about Native American or American Indian folks, which is all the same stuff, but Indigenous also in different countries could also still represent different folks as well on their land. So, but I know today's our topic. I don't know, Harlan or Hannah, you want to weigh in on this?
Sure. First of all, the way that I understand and operationalize Indigenous is I go to the United Nations Declaration on Indigenous People, and you'll actually not get a definition of what Indigenous is, but it's more of a framework. And a framework is of territory, of land, and it's people of that territory, and the first folks of that territory and of that land. And you can read through, and also, the impact of colonization. And it's more of like a checkbox and a framework that you get the definition. But the United Nations Declaration on the Rights of Indigenous People actually doesn't offer a definition, but I think it's a really good read of a foundational document. Now for Two-Spirit is going to mean First of all, it's an identity, sorry, it is a community organizing tool or strategy or a placeholder to organize those individuals who are Indigenous to Turtle Island, and so that is the boundaries right now, is Indigenous to Turtle Island, and who are gender and or sexually diverse. And I'm using um, neutral terms, but you could also define that as another way is Indigenous people to Turtle Island and who would be identify or use LGBT or lesbian, gay, bisexual, trans, queer questioning, intersex, and the list can go on and on and on. But you have to have the intersection of those two concepts or three being indigeneity and sexual and or gender diversity. Now, as soon as you, but there's more to that because it goes back to this history and this lived truth or lived experience. And I'm going to get on a little soapbox. People can knock me off later, but it drives me nutty. And we're not talking walnuts and syrup. Is on top of ice cream. What drives me nutty is that for the LGBT community or the queer non-Indigenous movement, a movement that has been calling for, you know, salvation, equality, and rights, but the arrogance in which that there was, and also a presumption of innocence, in that call for liberation and that call for equality. It doesn't actually ever begin with Indigenous people, and it doesn't specifically begin with Two-Spirit people. On this land, there were people that were engaged in same-sex sexual relations, full equality, full citizenship, and were completely integrated within society, i.e. liberation, i.e. equality. And yet non-Indigenous queer folks do that rally call for liberation, not copying to the fact that it is their Western ways and Western relatives that really messed it up for us as Two-Spirit people. And so, and the arrogance of it, the cultural arrogance of like, wouldn't they humble themselves and say, is there something that we can learn from those little Indians? You know, the little Indians that used to lift up their Two-Spirit people and that were honored, respected, had full citizenship and full participation within their society? No. We go back to the timeline told of like June 27th, 1969, in the birth of the gay rights movement. That is the birth of your gay rights movement. We predate that. And all conversations, especially around liberation and equality, should begin with Two-Spirit people. And it will be a radically different conversation. That's why we're here.
I want to add to that, if I may. So my angle, and thank you so much for that. I really appreciate that. Living as my lived experience as a Two-Spirit person, one of the things is in Winnipeg, Canada. And I think there was somebody from Canada, you know, in 1990, about 25 to 30 tribes came together and they derived a name. And not all tribes were at the table in 1990, right? So not everybody utilizes the name Two-Spirit. Some people, it was the encompassing of when they all came together was like, oh, okay, we got the masculine and feminine spirit. But we know in a lot in different lands and on Indian country, there's like 6 different genders. And there's been genders even before this got colonized way back in the day. People were being married same sex, and there were Two-Spirit people, you know, and before they used to call them bertiche, which was very derogative to us, and it came from the French. So if anybody speaks French, is a bertiche. And so we wanted to take that back. So in 1990, not all the tribes were at the table. So some of the tribal members are called, there's called different in different reservations, and different places, it's called different things. And a lot of times what happened is, and regardless of whoever's religion or, you know, I'm not, you know, politics or whatever, I don't want to put that in there, but there was a lot of stuff that came through colonization and religion and the Christianity that influenced our relatives now to push and shun a lot of Two-Spirit people away, you know. And one of the things is because so many things were being practiced, like in the residential, in the boarding schools, and just different stuff that was happening. They were just talking about the American way, basically, European way, and, you know, cutting people's hair, and, you know, and there was like two-spirit people in there, and they had to do, like, you can even, there's some stuff even on YouTube, and some relatives that talk about they did their own little powwows inside and shut the doors, and they would dress up and do all their stuff as far as being, you know, an Indigenous two-spirit person. It wasn't called that then. And one of the things is, when I hear in America, the United States, which we call Turtle Island, is that they're like, this is the first time we're married, you know, marrying two people on TV of the same sex. And I'm thinking, Indigenous, we have been marrying people for years and century before anyone came over to Turtle Island. So I was just like, I don't understand that piece. But I think, getting back to the two-spirit name, there's also been folks that have also embraced on different reservations, different places, indigiqueer, that they feel not the masculine feminine spirit, nor the six genders. And then you've got LGBTQ. And one thing I would like to say before I pass the mic, is that if you are not of Indigenous descent or Indigenous blood, it is frowned upon that you say that you are a two-spirit person, because they came up with that name. It was very ceremonial. So it was like cultural appropriation for any other of the races or the nationalities. So when we say we're two-spirit, you know, we were held in high regard, and still should be held in high regard. A lot of us get chased out of the reservations. We get pulled out of the powwows for dancing in our regalia, whether it's a skirt or a shirt. And so not everyone. Little by little, we're trying to bring it back to our traditions and cultures that have been ripped away from us because of the United States, specifically the federal government, what they did in the boarding schools. So I'm going to pass the mic.
And Hannah, I want to see if there's some space that you would add to this conversation right now.
Yeah, I mean, again, I'm, as a non-Indigenous person, I think first and foremost, I can't speak to many of the nuances of what Indigenous and two-spirit means. I will say, and I strongly learn and appreciate from my two-spirit like peers and relatives and colleagues who I work in collaboration with in my position as a physician who's worked directly within the Indian Health Service, and also like outside of the Indian Health Service on policy and systems levels, trying to support access to healthcare for two-spirit and like queer Native people. I think the one addition I will like throw in there, which I'm sure Christina and Harlan will have more to say about, is that like non-Indigenous people, including like clinical folks who are navigating interactions with queer folks who are Native, often have this assumption that someone says, oh, they're queer, or they're genderqueer, they're trans, so that must mean they're two-spirit. And I think that that's like an interesting phenomenon that plays out. Maybe I will say use that word to start with, but I think for me, as I've learned over time, like people who are Native, who are queer in whatever way, shape, or form, have various relationships to the term two-spirit and to how that relates to their own identity. And I make no assumptions that someone who is sexually or gender queer in any way is two-spirit unless they share that information with me. So I mean, like maybe that's one bit of addition I would add here as someone who's a settler who navigates a lot of space with other folks who are trying to figure out how to be culturally respectful and open and trying to understand what two-spirit means.
And stepping in, I think of really looking at our providers today, like access to care. What are you seeing in the current environment that are some of the disparities that are existing in access to care for our Indigenous and two-spirit communities? What are you seeing out there?
I would say lack of representation. You know, some people don't even know two-spirit, indigiqueer, any of that stuff. They're like, what is that? What is the 2S, right? And of all respect, you know, a lot of people are like, why are you putting the 2S before, you know, the LGBTQ? Because the lesbians and the gay folks, you know, they were around with it. I mean, I hear all kind of different stuff, but we were the first ones of the nation. Like we were here, you know, so the more education needing to that piece is so important. I think that what's lacking in the space is lack of education of two-spirit people, like in healthcare, period. You know, just like there is in the LGBTQ, you know, there's that part, but then there's also like, okay, well, two-spirit folks, let's talk about that stuff and how we're going to do best etiquettes for them as well too, when they're coming into the clinics or they're coming into the different places. Like, okay, maybe they don't identify as two-spirit, they're indigiqueer, but you know, or you know, maybe they do they're an LGBT person, or you know, the pronouns making sure that we address them in the right, respect. Also, what is around our buildings, whether we're in mental health, whether we're a doctor, is there feathers, like, 2 feathers up? Is there indigenous stuff around us, even with the different rainbows, or even we've adopted some of like the trans and the, Gilbert's flag inside of a lot of our stuff, which has colonized some stuff, but we have, and put some of that stuff, is that stuff up there. So that's what's lacking, because when I go anywhere, they're like, we don't even know what that is. What? We're usually the ones, the storytellers, to go ahead and give the story. I think lack of representation, and also even in our doctors as well too. They just, for them, some of them think that it's a brand new name. This has been around 1990. That's 35 years for that piece. And then before, it was derogatory that they used to keep us in French. And then even before then, it was other stuff on the reservations. And maybe that's the part. They just, the lacking of that piece, I think, is important. When somebody walks into your room, what do you have around your, is it safe for us? Have you worked with Two-Spirit people? Probably not. Or probably maybe a piece of you have, you know what I mean? So how do I know that it's safe for me to talk about, my, indigenous stuff? Because there's such a push and pull right now out there in political places, so like, am I going to be okay sitting down here talking to a doctor that looks the opposite of what I look like, or where I was born, or where I was raised, or where's my family from? So like, if I seen some, I mean, it's something minimal. I mean, it could even be the medicine wheel, but don't put something up there and not know what it means. Because then now we really don't like, what, learn the culture and be inviting. Invite us in, invite us into the teepee.
Hannah, it looks like you have some thoughts on this as well too.
Oh, I have so many thoughts and vibe a lot with what Christina is sharing. Again, as like a non-Indigenous person who's been invited into a lot of Native spaces and has worked in Native health systems in the United States, there's been the learning curve of my understanding of Indian country, of Indigenous healthcare, of what, again, culturally relevant healthcare might look like for a Native person has none of that I obtained when I was in medical school or in training. Or, as growing up as a person living in the United States, learning about quote unquote US history, it came from my experiences after I finished my training and pursued a career in Indigenous health and spent time living on Harlan. I worked on Rosebud for many years. It's I know Marcita, who you mentioned. It's like small worlds as they are in Indian country. But I worked on within an Indian health service site. So I think for me to back up to answer some of your question, John, what are Two-Spirit and other LGBT Indigenous people experiencing in healthcare access? We have to start by asking, what is it like for a Native person in the United States to access healthcare? And that the disparities inherent to accessing healthcare for a Native person are significant. Just in terms of even routine general medicine, primary care, specialty care, within the Indian Health Service, which is the federal agency that provisions healthcare for Native people in the United States. The legacy of the Indian Health Service is tied to the founding of the United States, the ceding of land by tribes to the federal government by force, often in exchange, quote unquote, for things like healthcare services. That is the legacy of the Indian Health Service, which today, so again, the Indian Health Service is comprises an agency that intends to fulfill a constitutional and legal obligation of the United States to providing care to Native people. But they fail to do that in a substantive way because of various forces that play out in politics, notwithstanding the current administration. But historically, the way that they fund the Indian Health Service leads to the inability for routine, good medical care to be provided. We could have a longer conversation about what the Indigenous healthcare looks like in the US, but that's the short summary, I think, to take away from that. So the kind of challenges it takes to provide care in often rural and remote parts of the country where Indian Health Service hospitals are the main and only places where people can access care, finding good clinicians, people who are actually kind, able to do the work, have good training to do it. Often these are non-Indigenous clinicians, because less than 1% of the physician workforce in the US is Native. Don't quote me 100% on that demographic. I think it's less than 1% though. so like that context is important. And then figuring out how to navigate a federal healthcare system and provide clinical care in that setting is the context that every person who walks in an exam room to see a Native patient needs to take on the responsibility to navigate. And that is challenging. It's also challenging providing care in rural and remote parts of the country if you're even in a non-Indigenous healthcare system. So like that's some of the backdrop of healthcare for Native people. And then you add in the intersection of being queer to that. And you're queer in rural and remote parts of the country. Some tribal nations are like more open and supportive of queerness, and some are not. Some states in which these tribal nations like abut are more or less supportive or open to things like queerness. And you compound the challenges of what it means to access good routine healthcare and also safe healthcare, where you can walk in the door and talk to a provider and be like, hey, I'm queer. I don't 100% know what that might mean here, but these are things I'm thinking about. Like I'm rambling a little bit here, but just to like try to present the picture of what it's looked like for me and people I work with and support to try to take good care of Two-Spirit and LGBT people in Indigenous healthcare systems, which has been part of my job for the last 4+ years. Like there's a lot of challenges on the healthcare provision side, and then a lot of courage and bravery that it takes for a Native person to walk in the doors of an IHS, for example, or a tribal facility and seek care.
Mhm.
Well, I don't think I'm going to add anything because Hannah but I would like to share with you a couple of stories, because I tell stories, right? 'Cause that's what we do. When I was living in New York City, and I was one of the founding members of the Northeast Two-Spirit Society, and we had a member who was Mohawk, and most folks would not seek health care within the city. They would have to go home so they could get free health care, and that was the inequities. It's not portable or transmittable. And so Ryan was thinking of going home and getting their sexual health screening. And around that time, their sister got a pregnancy test. And so the sister was driving home of like, who do I tell first? I tell my mama. How do I tell my mama? And their phone rang, and it was their mother saying, wow, I'm going to be a grandmother. And so Hannah, when you were like, what a small world, right? Like many of these set places, they're staffed by community members, not at the clinician level, but the actual support staff, right? And so that again, Ryan was like, well, that's not a space. And then, Ryan did not go to that healthcare center because they were saying HIV screening, that's going to get back out to parents. And so that's where I begin with the story. I say, what we can do, first of all, really super practical things, is walk outside of your agency and walk in as a client. Like put yourself in my moccasins or a community's moccasins. Go through the intake process. What does your intake form look like? Is there any seating space for Two-Spirit people? I'll put in a link to a method on how to collect Two-Spirit. And yes, absolutely, not everyone is going to use the term Two-Spirit. So there's that. And then sit in the waiting room. What is the environment? What does that look like? Are there feathers? Are there rainbows? Are there Two-Spirit stuff? And then just go through the practice. And it's just like, that is on a very practical level. And then I think that, again, we need the technical assistance as well as the training of like what Hannah was like saying, that lived and our living experience of embedding within the community. For us as within the Cree community, Nehiyao community, nation, is all knowledge is relational. And nothing would make us like, we're not going to say, if we're doing a meeting and a powwow, we'll not say to our non-native relatives, go away, come. Because once we know each other, there's the possibility for knowledge and knowledge sharing. And you might have some knowledge around syphilis that we may want to know. And then, like I did and developed a 2-day training, and I've like piloted it all over the place, mostly within substance abuse centers. But the Ho-Chunk Nation, they brought me in to do a 2-day training for their healthcare center. And we went through processes of like, did they have same-sex benefits? Because if the two-spirit people and queer and indigenous folks don't see themselves within the staff, that's not going to be a safe space, right? Or a space that may be fraught with navigating it, right? And I'm now looking at my notes and I can't even read my handwriting. So I am going to stop there. But I think just on a very practical level, just walk through your space and walk through, I don't have to be white to walk through universities and understand your culture. I see it. I read your cultural language. I see it within how conversations are structured. I see it. And if I can see your way, you can see my way. I'm not special. And but it takes a little bit of time of like, if I were indigenous, if I were indigenous, if I were LGBT and indigenous, or two-spirit, how would I look at this space and this world? Now, if you want, I would encourage you to do that exercise yourself. And then if you wanted to validate to see whether or not you got it, and again, go and meet the community. Find your one or two champions, your one or two leads, and say, hey, can you do a walkthrough? Come to our clinic and do a walkthrough. Now, you can also, through that intake process, a happy customer is a repeat customer. How many Indigenous people are you serving right now? That's your baseline. Once you do all this work, you then can say, how are you attracting and providing more services, and more importantly, repeat services if you want an evaluation framework. Because if I'm not feeling safe, I will never go back to that location. And those are just two simple little data points that tells you exactly where you are as an agency. Are they coming? How many are coming? But more importantly, are they coming back? And if they're coming back, you give yourself a gold star because you've done the work.
And if I might add to that, Harlan, respectfully, are they also referring other people to you?
That will always happen. That's called the moccasin telegraph. That's us.
Because once again, we know this, especially in trans and non-binary care, that when a certain medical office becomes incredibly proficient in the care, it goes out into the community and everybody's like, I need to be seen by you. And so I think that's another marker that you could add to that. But there's a really powerful question that's sitting in the Q&A right now. And I want to bring it in because it also, I think, addresses some of the mental health challenges that also need to be addressed in our quality of care. And this is really looking at a person who was talking about addressing intergenerational trauma of working with LGBTQ individuals who may have discovered their Indigenous roots from which they were previously unaware. And we know there are myriad reasons why that may have played out in their family history, but really looking at that intergenerational trauma and the access to mental health care as part of this healing process. So I think there's a question in there somewhere. I think you all can see the question too. Does anyone want to throw some energy towards that for me?
Yeah, I'll jump in there real quick. One of the things is we're storytellers, right? So one of the things is I'm like a little hummingbird, right? So I tell a lot of stories when I talk. And the thing is a lot of our elders, because of the push of colonization of not, there's a whole bunch of religion that was pushed onto a lot of different folks, specifically in the boarding schools. So a lot of intergenerational, and I should even throw in historical trauma, has affected our communities all through all different tribal nations, because of the fact that people don't even speak about us anymore. That because a long time ago, when they would go ahead in the 1800s, they'd round up everybody, which were like the warlocks and people that did, spirituality. Like when back in the day was like, they would go and they would burn all the witches. Well, they'd throw the two-spirit people in there too from the different tribes. They're like, we're going to grab them up and we're going to throw them in there too. So the tribal folks too were like, no, we're not doing that. We're hiding them. So a lot of the tribes don't even talk about us anymore, even though we were held in high regard. We're spiritual, we're matchmakers, we're name. We the power of naming. We were asked to be pulled, to whenever that there was, like, a lot of times when we're in the rooms, we're asked to pray. And our, because we're spiritual people, not spiritual, but we're sacred. because they look at us like we were able to look at through the eyes of the lens of the masculine and feminine spirit. Therefore, we're two spirits, right? But not always is there everybody that says, hey, I have two spirits, right? But getting back into the intergenerational piece, and also for the part of the historical, like the trauma altogether, a lot of times, and I love, is it Harlan? Yeah, talks about that he's a storyteller. I see any pronoun. Yeah, so he's a storyteller. And it's important that we continue to tell our stories, but depending on how our relatives or our elders tell our stories, some of us are like thrown back, like, oh my goodness, this is what happened to us. But are we even talking about these stories to continue? It's like we're all like resurrecting back up from a place that's been forgotten about because we were held in so much high regard to the chiefs. We were like the seconds to the chiefs. But the thing is they wanted to kill us, so they would go ahead and they'd even riled up the gay and lesbian folks too, and that's how they even got the term, the F word, because the bundle of what is it called, wood and stuff like that, the border, they burned everybody up, but they forgot, and they didn't even talk about the two-spirit people that they threw in there too. Terrible, right? And so I think the people stopped talking about us, our two-spirit folks, in whatever languages that their tribe would talk about us. So our trauma was like we were forgotten about. Like, that's how I feel like we just got cut off, and now here we are trying to resurrect back up, even though we've been around and want our elders around, but we're elders. Like Arlen, I consider him an elder because of the information. He's like, no, not yet, but like as a two-spirit elder, that's what I'm saying. So sometimes we need two-spirit elders to lead the pack, because our elders have not spoken of us, because they have been colonized in the religion to push in whatever, I'll go back to the tribal piece of where the federal government came and cut everybody's hair off, said you can't speak your language, can't do any of that. So a lot of us lost our culture. We lost a lot of all that stuff. So the thing is we're still, like me, I'm still trying to figure out and pull out and learn Apache, because I'm thinking if that would have never happened, I probably would, I'd totally be something different. I'm what the American government succeeded. I'm very educated. My hair's cut. I know part of my, my heritage. I need to know more. So I'm exactly what I'm not supposed to be here. We're all supposed to be, we weren't supposed to be here. We're all supposed to be dead. And so, I mean, I'm exactly what they wanted. An educated Indian that has lost a lot of their culture and has and trying to grasp it and keep it, and even with my little girl, and have her understand what Apache is and learn now because of the intergenerational piece that has been taken away from me because of what has happened in the 18 and 1900s in that piece. Anybody else want to weigh in? I'll send it back to you.
I might add, I mean, I have stories of coming into a relationship often, sometimes, not often, sometimes in like meeting patients who then see something I'm wearing. So I wear a lot of like, I'm gifted sometimes like earrings, like I'm wearing copper canoe woman earrings, and I have beaded earrings, and sometimes different things that I'm wearing in clinic, or shirts sometimes that have like Indigenous like print or things on them, and patients key into them at times and like then share with me that they have Native ancestry, or they think they have Native ancestry in certain ways, and it's a complicated reality for a lot of Native people, and I can only speak to it so much, but to acknowledge like what it means to be an American Indian or in a federally recognized tribe versus a state tribe versus like, these definitions of what it means to be Indigenous, back to that earlier sort of bit of our talk, it's very complicated. And so what I find to be the most beautiful and important, one of the most beautiful and important things is that I have come across some people who are Indigenous and queer in my clinical work in particular, and having the ability to be in relationship with them, to ask them questions if they have some connections to their tribal lands, to their community, to their culture, to help them know that I see them and understand them maybe in a different way than the average clinician who walks in the door, has been a delight. And sometimes to be able to relate with folks who might be able to access care in the Indian Health Service who wouldn't otherwise know how to access that care has been an opportunity for me to like step up as a settler and like help Native people access the care that they deserve. And also then give them opportunities if they want to connect with peers and colleagues I know in community so they can learn more and be in relationship with other Two-Spirit and like LGBT folks. So it's a long-winded way of saying, I feel like my role in a lot of this is to try to hear people and hear their maybe questions and then connect them to other folks who might answer those, who are in the Native and also queer community. And also to just see them, like Christina was mentioning, like I mean, there was a patient I once met who was in the hospital. Again, this was in a non-Native hospital, like in a big city, and they had a medicine wheel tattoo on their body. And I met them in the setting of like, you know, not knowing they were Native, and I looked at it and I was like, "Oh, are you Native?" and like they are, and they're Native and queer, but they were not well connected to their ancestry and to their community and their culture, and so over time we developed a relationship in which then they were able to meet and connect with other Native queer people, and it was a beautiful thing and important for them, and felt like an important thing for me to do, and be positioned to do.
Mhm.
I have to answer this question for Audrey Zotopek. No, I wasn't saying get a Two-Spirit waiting room. What I was like saying was put yourself into our moccasins, walk through the door, do the intake process, go sit in the waiting room, look around, pretend you're one of us at a base level, and then validate that after you've done a little bit of work to see whether or not you got it by bringing in other Two-Spirit people and let them walk through and engage the center. And if they see themselves, they will tell other peoples. And so it's also kind of cool. So I got to answer that question. But for historical trauma, is I don't think that we have the proper tools. In that, I think that when we look at mental health often, is that we look at it as episodic, where for historical trauma is systemic. We look at the residential boarding schools where all of our Native children were ripped from reservations, rounded up, and put into train cars and fuddled off to schools where they had Indianness beaten out of them.
Mm-hmm.
And then my mother went to one of those schools with my aunt, Auntie Pippi, had her Indianness beaten out of her. What did she do? She came home, had 3 beautiful children, and she did that what she knew. She wasn't spoken to with kindness and love. She didn't speak to us with kindness and love. She was beaten, she beat us. And it is how historical trauma bleeds into intergenerational trauma that has impacted, like, yeah, I am impacted by the residential schools because my mother was horrible. So much so that I moved out and emancipated myself when I was 16 because it was so much. But this is not a, okay, I'm sitting on my couch. So Freud. No, the thing is that I think we have to look at our tools is like episodic as opposed to systemic. And first of all, I think that you have to inform yourself of this history. And I think Hannah did an amazing job of like trying to unpack of some, like just informing ourselves, not from a grade 11 textbook that has a little paragraph that says there were First Nations people here. And then they kind of went away. And then gone to the real history that you write about, that you write essays on, not of a little paragraph. But I also think that, again, going back to these tools, that I firmly and humbly believe that anything that instills greater cultural pride has a direct and a positive relationship to pride. We don't like to talk about pride, right? But we do know empirically that those that say love and like who they are, take pride in who they are, have better health outcomes. And so that is not going to happen in a clinical setting. However, if you've done the work, and just like Nadine said, get to know the community, get to know the culture. Is there a local Two-Spirit organization? What is the Friendship Center and where are the Native people going? Is that a safe space for Two-Spirit people? And so that when you have a patient or a patient, client, clinician, these are all power words. Patient, doctor, power dynamics. So it's a relationship. But if you're visiting with someone who is accessing services And you see how that is a different tone immediately? If you're visiting with someone accessing services, they may have you can use your episodic tools, but then you can also do a real live intervention. Hey, do you know of this Two-Spirit organization? Do you know that there's a powwow coming up? How connected are you with that? And then you become a referral to the community and a portal to the community. You are truly being a medicine people. And you're looking at this as ceremony. If you look at the heart of all of our ceremonies, is connection. Right. And so I think there's ways in which that, and yeah, doing a referral sheet of like the local resources, but you will have to get to know those folks. You're connected. You will feel healthier. The individual accessing services, once they're connected, they will feel healthier. And so I'm just picking up on threads that Christina has already said of get to know the community, get to know the culture. Hannah is actually living that. And so that's what the secret is. There's no big secret sauce.
And
It's
one
just,
thing that's, I apologize, Harlan. One thing that's showing up thematically in our questions right now is a lot of people are just asking, well, where are some places to start? Some places either to connect with community or to get education. And we're in a world right now where accessing stuff online can be incredibly powerful first step for a lot of people. So I'm wondering if you all have some direct referrals that you would make of websites or organizations that people can connect with to either as a practitioner start their care, or as someone who is still exploring their Indigenous and Two-Spirit identity could also step in and find more about that. And maybe share them out loud, but also if you are able to put them in the chat box so we can see them.
I was going to say two things really quick, and then I'll pass it back to my panelist. The first one is for the folks that are two-spirited, and also the general public is also invited to. I live in California, and so in California, there's the Bates Powwow, and the two-spirit people gather from all over Turtle Island that come down there, and then there's also Gona in New Mexico that, they come in and they do the open ceremony as well too. And then the last thing is Montana. They have a two-spirit gathering for those but you have to be two-spirit, like you need to be two-spirit or you're recommended through an elder or a relative to go to Montana. I'll have to get you the information. Thank you, Daniel, for putting the bates.org information. And you don't have to be native to go and be a part of it. So like if you had non-native, because a lot of people don't know that. Sometimes it is open for the public and sometimes it's not, and they'll let you know. Okay, but a lot of it says on the powwow things, general public, welcome, so-and-so loud. There's special dance and there's special etiquette when you go to a powwow or to ceremony, and ceremony is a little bit different, but it's a little bit different. But I just wanted to, there's the Bates Powwow in California, and that's where I live. And then if my panelists want to jump in and put a couple other resources.
I have some that I can recommend. I have to tell you, it's a difficult time in the United States. I think all of us can understand what I mean there. And so I'm going to share a website for you, but you need to look at the versions before this week on like the Wayback Machine, because the website's currently down. So what we're seeing, is a lot of like, both on the federal side and then sometimes on the tribal side that where funding is coming from the federal government, that like 2S LGBT focused materials have been brought offline. You may know now that the federal government has put back a lot of the 2S LGBT focused materials, but they have this like header at the top that says things that are unfortunate, but the information is still there. So I'm going to list the websites for the IHS's, the Indian Health Services 2S LGBT resources, which have a number of links. And then also the PAS Remembered project, which is the 2S LGBT health initiative at the Northwest Portland Area Indian Health Board. That is where I've been a contractor for the last 4+ years doing all the work I'm describing, which is, policy work, advocacy work, clinical capacity support for Native queer people across the country. The website is currently down, but you can access it through archived versions. And there's tons of resources we've created over time. We have toolkits for creating affirming spaces in your clinic or like work environment. We have toolkits for supporting queer youth who are Native. And then also, if you want to message me, the website is down, but we have provided cost-free mental health services for folks who are 15 and older and identify as 2S LGBT and Indigenous through the Past Remembered Project for several years. And we are still providing that service. It's just you can't log in to the website and sign up for it. So if you have clients or folks in community who are looking for mental health services at this time, whether it's related to gender or queerness or indigeneity or related to mood or mental health needs, then you can email me. And also, like, I am here to support any folks who are trying to navigate or connect Native people to care in the Indian Health Service or outside of the Indian Health Service, given the current policy environment. It's confusing and challenging. And what we're seeing at this time is that the Indian Health Service has paused indefinitely, potentially, gender-focused medical care for folks who are younger than 19. Very abruptly, that happened after the executive order came out on the 28th of January on gender care. And then that referral care services for a lot of IHS beneficiaries, regardless of age, when they're accessing gender affirming care outside of IHS and to be paid for by IHS funds, have been halted as well. So if you're having issues with navigating patients to care, or you have a Native queer patient who's needing care or community member, I'm here to be a resource for you, though these are hard and odd times. So I'll just give you my email and suggest the Wayback Machine.
What I would do is, just on a very practical level, is to do an environmental scan of your local community, because there's probably a Native gathering space. It may not be formal, or maybe like informal. It may be episodic, like pop up, like it could be a powwow, but I would go and humbly go. And the first time you may meet no one, but just experience. Right? There's so much distrust within our community. It takes a little while, right? That's why we, like here in Canada, they're trying this new funding model for research, where for the phase 2 was just to build the relationship. So it was like $98,000 to meet with the local community, test out models, and then you actually applied for the big pot. It's to build those connections, those webs of interconnections first, is what I would happen. There is also, like, if you type in Two-Spirit, what did I just type in? IHS Two-Spirit Health Resources, or just type in Health Two-Spirit, or type in Canada. These conversations are the same kind of conversations, and the materials and the resources are still available here in Canada. So do a Canadian search if you cannot find anything. On a very practical there's many recordings, they're still up. I just looked at the UBC's Two-Spirit in resource page. It is still up. So there are many, many resources here north of the medicine line that are still operational, still accessible, and that you can still act upon this. And it's so funny that we're like, the resources to be in better relations, and that's our resistance. But it has to be our resistance. And why I say that is that if we pick up the colonial tools, it means that colonization has won, because they have made us forget who we are. We are welcoming, and our sacred teachings mean that we must stand and to work in good relations with one another. And I don't think the colonizers understand that when we invite you in, it's an ultimate act of resistance. It's a resistance of love. And so it's again, all knowledge is relational. A priori to knowledge is relationships. And that we must keep that in mind, right?
And Harlan, on those incredibly powerful words, I need to bring us to a close for today. I really want to thank the three of you for taking the time out of your incredibly busy schedules, sharing from your lived experience, your educational experience, and just the wisdom of your hearts. It's been beautiful speaking with all of you today. And thank you for that in offering this to all of our listeners. Joe, just kind of as we're closing out today, I want to share with you 4 here at OutCare Health, it's really kind of cool for our 10th anniversary. They've done a whole like fantastic new rebrand. There's a new website up. There's all kinds of new program stuff that we're bringing into the community at a time when it's really needed. I invite you to go and look at the OutCare Health website and take a look around. There's some new stuff in there that can be really useful. Also, this recording will be available probably starting next week, and you can have it as a resource to share with other people in your community. On April 17th, we're going to be coming back together for our next Out Care Talk. And this is going to be really looking at inclusive care, this kind of crossroads we're at right now, as the words diversity, equity, and inclusion are being erased from the world around us. How do we find ways to make sure that marginalized voices aren't lost in this process, and how we can come together as a community to really create individual care that's compassionate and of high quality, and what we deserve as members of the LGBTQ community. So thank you again all so much for joining us today. Be well, be safe, and I'm honored to have sat in this space with you today.